Hello everyone and welcome to a new episode in our program In Sync. Today's episode is really interesting and I think it has concern to many families in Kuwait and outer Kuwait all over the world, and many misconceptions regarding this condition and this syndrome. But before I go further in introducing our topic today, I would like to welcome my colleague and my friend Dr. Mariam Aldashti. Hi Mariam.
Hi Sundus, how are you today? I think we have an interesting topic which is different than anything we've discussed before.
Definitely. And I think there are many misconceptions regarding it. Many have problems in differentiating it from other similar conditions which have similar symptoms and similar, let's say, prognosis.
Absolutely, you're absolutely correct. So without further ado, we'll introduce our topic, which is Alzheimer's. Yes, and Alzheimer's is a progressive disease where people tend to not only lose their memory, but also lose their functional ability. And it's a neurological disease, a biological neurological disease that affects the brain, parts of the brain, and thus affects how the person or individual is able to carry out their functional daily activities.
Definitely, Mariam. And I think Alzheimer, when people hear about it, usually they are afraid of what are the rumors that is spreading around it.
Absolutely.
You know, in Ramadan, one of the series that were produced, one of the actresses actually was diagnosed to have Alzheimer.
I saw that one. Although she was at an earlier stage than the recommended or the research says, which is above 65 usually.
Yes.
She was younger, but that doesn't mean it doesn't happen.
But you know, she played it beautifully because her reaction on having the disease is actually what people normally have when they are diagnosed with Alzheimer. Why? Because they think that this is the end of the road.
Absolutely.
My life has ended. I'm diagnosed with it. I only have a few months or a few years. Then I will be debilitated. I
forget everyone.
Exactly.
I will lose my identity.
Rely on other people to take care of me. But this is the aim of our episode today. We want to highlight the symptoms, types of Alzheimer, and what are the modalities of management and treatment.
Of course, yes. And hopefully we give hope to people who have been recently diagnosed with Alzheimer's, or people who have someone that they're taking care of when it comes to Alzheimer's as well.
And actually one of my friends, she called me and she was crying, and I told her, you need to watch our episode today in order for you to know all the details about Alzheimer's disease. But she told me that her father, Abu Ibrahim, he is a 55 years old engineer. And he was known to be very sharp and very meticulous in his work. But he started to be forgetful, and they thought, my friend and her siblings, they thought that this is because of aging and this is normal. Every once in a while, everybody will forget something. So they just ignored it. But then with time, they noticed that he has been forgetting where he put his keys, and it became something regular. He started to have problem with words. And then later they found that he is having problems in numbers. So she thought this is abnormal. My father is very bright, very good with numbers, with mathematics. So this is unusual for him. I need to go and check. And actually she took him to a neurologist, a specialist. And after further investigation that has been done, and we will go through it later on in the episode, he was diagnosed with early stages of Alzheimer's disease. And they were counseled and given the management, the prognosis, and after starting the treatment, actually he's doing well.
That's amazing to hear, because it's sometimes obviously a burden on the person themselves. But I think the loved ones around them are the people who can be affected more, because they are the ones watching this loved one deteriorate. And on the other hand, the person who has been diagnosed with Alzheimer's, they think, I'm going to become a burden on my children, you know, and no one obviously wants to be put in that situation.
Exactly.
But nowadays, medicine is evolving. There are things you can do to slow down the progression of this disease. And hopefully from the end of this episode today, people come out with at least some hope and information.
Exactly, Mariam. And with my friend, as you said, with family members, she was really devastated and she was crying, she was depressed. What's going to happen to my father? How are we going to take care of him? Is he going to die? All of these questions. And I told her, don't worry. As you said, the medicine has evolved over many years, and many new medications and many new surgeries, advancements assessment, all of these have been developed in order to make their life easier.
Absolutely.
As you said, this is an ongoing disease, and there is no definitive cure for it. But fortunately, we have some medications that slows down the progression of the disease and maintain the normal functionality of that person.
Absolutely right. And I think it's worth mentioning the difference between Alzheimer's and dementia.
Yes.
Because sometimes people confuse them. And basically, just to put it in simple terms, Alzheimer's is a type of dementia. Dementia is a broad spectrum that describes multiple symptoms. So Alzheimer's is part of dementia.
Exactly. And Mariam, over 55 million people around the world will have dementia after the age of, let's say, 65 or 75 years of age. And the more you increase in age, the more chances that you're going to have dementia along with Alzheimer's. Out of the 55 million people, 60 to 70% of them will have Alzheimer's, and the rest will be other types of dementia.
Yes, absolutely right. So it's not something, you know, you should be scared of, and hopefully you're able to still continue living a relatively independent life when it comes to this disease.
Definitely, and the percentage of Alzheimer is not that low as people may think. They think it's not very common, but we hear it everywhere. And once you reach the age of 65, then 1 or 3 out of 1,000 people will have Alzheimer each year. But when the age increases up to 75 and more, the percentage will increase. It will be 7 to 10 people per 1,000 people will have Alzheimer's disease.
Yes, and that's considered obviously a higher number, but there are ways to work around it to avoid becoming diagnosed as well with Alzheimer's.
Exactly, and being examined also, it's very important, because by the time you reach 75 years of age, the chances of having Alzheimer will increase each year by 5 times.
Yes.
So that's why it's better to go checked up if you have any problems, any forgetfulness, unexplained frequent forgetfulness, then definitely you need to be checked up.
Absolutely.
I think we should take a break for the Did You Know report and join back again.
Absolutely.
Stay tuned. Hello everyone, and welcome to a very interesting episode. Before the break, we talked about Alzheimer and what are the concerns and what is the definition of Alzheimer. But now we're going to go more into details. How does it happen? Alzheimer is not part of aging. It's a neurodegenerative disease. From the name, it means that the neurons are degenerating and losing their function. Why does it happen? It's because of 2 major proteins in the body. One of them is called beta amyloid plaques. Those plaques are part of a larger protein that are responsible for maintaining the outer layer of the neurons, so making it easier for the communication between the neurons and transmitting signals.
Yes.
The other part of protein is called the tau protein. The tau protein is in charge of delivering the major nutrients and blood supply that is required for the neurons. If there is any problem in getting rid of the beta amyloid, then they will accumulate and will form plaques or debris. It will accumulate on the cell, and then it will make it die and lose its function. So the signaling between the neurons or the brain cells will be lost. That's why it is a degenerative. So one cell will be affected, then it will affect the neighboring cell, and then that's it. It will affect the whole brain. With time, the brain size will atrophy. The other one, the tau protein, also there will be dysfunctioning in them, and then the supplies for the nutrients and the blood supply will be tangled. So also it will compress the neurons and it will make them lose their function, and it will also lead to atrophy of the brain or smaller
the brain
size of
smaller.
the brain.
Yes, absolutely.
The stages of Alzheimer, they are 4 stages. There is the preclinical stage, and this might take many years in order for the symptoms to appear. So it's a silent stage. There is ongoing brain loss, there is ongoing neurons affection, but the symptoms yet did not appear. And then there is the mild Alzheimer, where there is loss of part of the memory, but it's not interfering with daily activities.
Yes.
The moderate Alzheimer, there will be loss of memory, but not the daily rituals. You will still continue to know the names of your children, how you dress up, what are the cup is what for, the key is what for. You will know all of these things, but the memory, the short-term memory, like where you placed your keys,
Yes.
where did you put your cup, it's that where this stage it will be lost. And this is where it will be the misconfusion regarding, is it something that is normal with aging, or is it really Alzheimer, or is it the other parts or aspects of dementia. Then there is the severe form where the fine skills will be affected also. So the person will not be able to wear the jacket properly. So they will forget how to dress up, how to wear the jacket, how to wear the trouser in our traditional clothes, the dishdasha, how to put the qatra, or how to wear the hijab and abaya. They will have problem in what are those keys, how to turn them on and off, the mobile phone, how I will use it. They will have a problem in putting numbers together. So adding like 1 + 1, they will not know it will equal to what. So this is the severe form or the severe stage of Alzheimer's disease.
Absolutely right. I think also, Sundus, if you'd agree, it's worth mentioning that it differs from MS or multiple sclerosis. So we explained before that multiple sclerosis also affects the neurons in the brain, where the myelin sheath, which is the part that covers the neuron, is affected. But this differs, Alzheimer's differs when it comes to the actual cells, and like you explained very well. So they're both technically neurodegenerative diseases, but one displays or portrays a little bit different than the other. But they are both parts of diseases where a person can obviously become severely affected or mildly affected.
Exactly, yeah. And there are, I think, as you said, the problem with MS, the myelin itself, but the neural cell or the
signal.
Exactly, the cell itself is preserved.
Exactly.
The symptoms will appear earlier. This depends on the type where is it affected.
And their cognitive is not really affected when it comes to MS or multiple sclerosis.
Exactly.
Versus Alzheimer's, it's actually their cognition. They, at a severe stage, they even forget how to go to the bathroom.
Yes.
And this is not something that you find with MS.
Yes.
They know they need to go, but they cannot.
They cannot.
So this is the difference between the two types.
Exactly, yeah. And I think there are many risk factors in order for a person to have Alzheimer's disease. Would you like to mention?
Yes, absolutely. So some risk factors is age, of course, like we explained in the beginning of our episode, where once you reach the age of 65 and higher, you are more likely to develop Alzheimer's. And again, like any other condition, genetics does play a role when it comes to Alzheimer's. And sometimes also having family history, you are higher likely to develop Alzheimer's. And these are, things that are in any condition, even as simple as diabetes.
Exactly.
So Alzheimer's is also part of this as well.
Exactly. Smoking also plays a part. People who smoke a lot, it will affect the function. As we said, it's not only affecting the heart, it's not only affecting the lungs, but it also will affect the brain and how the cell will function. So it will lead to alteration in those proteins that we just mentioned, which will lead to early stages or early signs of Alzheimer's disease.
Yes, absolutely. And also part of it is sometimes could be environmental, not really, but I think the more you are using your brain at a younger age, it's actually, research has shown that it decreases your chance of Alzheimer's.
Definitely. Sedentary life also.
Yes,
being inactive, not moving, not exercising. We mentioned that before in many episodes. It will affect the brain and it will affect the blood supply, how the brain regenerates. So all of this will be affected by inactivity. So being inactive or having sedentary life without doing any physical activities, then you are more prone to have Alzheimer's disease.
Absolutely. And diet does not directly contribute, but indirectly contributes. So if you're not eating healthy diets which feed your brain, such as healthy fats, omega-3s. It's not going to obviously cause it, but it might accelerate it if you are diagnosed with Alzheimer's.
An interesting fact, Mariam, actually, and I have read it while I was reading about Alzheimer's disease, because it's something really interesting.
Yes.
And I was really interested to know all the risk factors. And it caught my attention that Down syndrome or patients with trisomy 21 are more prone to have Alzheimer's disease, and that's because chromosome 21 is responsible in a way. They don't know yet in research how it is affecting the beta amyloid protein, but in a way chromosome 21 is in charge of regulating that protein, and because it's abnormal in patients with trisomy 21, then they are more prone to have Alzheimer's disease. And usually the time of onset of the disease is 15 years earlier than the normal population. So we said that usually it starts with the age of 65, but with patients with trisomy 21 by 50, exactly.
Yes, okay. So this is a very interesting fact. I didn't know this fact personally, so I think it's something to take away from today's episode. So just to summarize it, I think people should not be scared and start to think and pick on every single detail, but rather live a healthy lifestyle. Try to exercise, try to avoid heavy meals and processed meals, because you might not be definitely diagnosed with Alzheimer's, but it definitely can increase your risk. There's being risk factors.
Exactly. And also another point that caught my attention, you know that you need to exercise your mind, not only your body.
Exactly.
How? There are many games or like challenges that you challenge your brain in a way that you make it organized, stimulated for more cognitive thinking. So exercising your brain daily will prevent or reduce the risk of having Alzheimer's disease.
Yes, absolutely. And let's talk about our population, because with duaniyas and playing cards, there are some card games that actually need to stimulate your brain.
Yes.
So it includes math, includes critical thinking. So this is something that at least, unwillingly, unknowingly, people can be doing to decrease the risk of Alzheimer's.
Exactly. And as you said, Mariam, because of all of that, even though genetic is or family history is part of it, but only less than 1% are known gene to draw a blood test and to look for it in order to see if you have a risk of having Alzheimer's or not. And the rest, they cannot find any gene. So just don't worry about it. Even if you have family member, doing blood test will let you know if you are more prone or not. I think we covered most of the risk factors and the stages of Alzheimer. I think we should take a small break and come back again for the management and prognosis. Hello everyone, and welcome to the last part of our episode, how to manage and prevent Alzheimer's disease. As we said, Alzheimer's disease, unfortunately till now there is no cure and no definitive cause for Alzheimer's disease, so there is no prevention. But we talked about some of the risk factors that may lead to Alzheimer's disease, and this we can avoid them in order to delay or reduce the risk of having Alzheimer's disease. The management of Alzheimer's disease, we have actually three modes of management. First, we have the cholinesterase inhibitor, and these inhibit the acetylcholine in the body. Acetylcholine is responsible for the breakdown of the neuron cells. So this medicine helps to it slows down the regression or the breakdown or the cell death of the neurons, and it is usually effective in the mild or moderate cases. Then we have the memantine. It regulates the glutamine, and this is very important in order also to regulate the signals between the neuron cells, and it helps to alleviate the symptoms in cases of moderate to severe stages. Sometimes we need to combine both memantine and cholinesterase inhibitor in severe cases in order also to improve the cognitive skills in those patients and to alleviate the symptoms.
Yes, speaking of cognition, there's also cognitive behavioral therapy. So this is a therapy where they stimulate and try to exercise the brain, like we relatively mentioned before the break. So they give you tasks to constantly exercise your brain, like mathematics, for example, some challenging games as well, some board games that need thinking. So they use methods to stimulate the brain so it's constantly working at that part or stage. There's occupational therapy. Occupational therapy targets how you're able to perform your daily activities. So for example, how to stack cups on top of each other. So this is you're moving your muscles as well as knowing what to put on top of each other. A pen and paper, writing. This is stimulating your brain, and at the same time, how to perform some daily activities, just like writing or signing your name and such as those things. So these are methods where they're stimulating the mental and physical capability of an individual.
Yeah, and as we said, also we have to use the risk factors, and in order to know them, we can prevent them and reduce the risk of having Alzheimer's disease. And one of them, we said, sedentary life is a risk factor. So exercising regularly is important. As you just mentioned, exercising the brain and exercising the body.
Absolutely.
Exercising the body will help to maintain the muscle tone, will help to tone the elasticity and maintain the elasticity of the joints, and also to make the brain works better and increase the blood supply to the brain.
Absolutely.
So exercise is very important to reduce the chances of having Alzheimer's disease.
Of course, and there are obviously some medications that can target the beta amyloid proteins and other medications which also help with the reduction of the tau protein, and anti-inflammatory as well. So there are medications that can relatively control, hopefully, and slow down the progression of this disease, that it's neurodegenerative in the brain cells.
Exactly. And also one of the risk factors also is smoking. So quitting smoking is very important. As we said, it will affect the brain and leads to cell degeneration. So quitting smoking starting from now will help to prevent or reduce the risk of having Alzheimer's disease. Having a healthy diet, avoid processed meat, avoid high food with saturated fats, take food rich in antioxidants. It's very important. The antioxidants, people think that it's something just to make you feel young, but also it will make the organs be young. It will lead to reduction in the cell death. It will lead to reduction in cell degeneration. So antioxidants are very important to preserve the function of the neurons, and thus will lead to reduce the risk of having Alzheimer's disease.
Absolutely. And let's not forget the most important part of trying to avoid it, or even if you're diagnosed with it, some support and mental support and education to the patient and to loved ones. It's a hard disease, it's a hard condition to be diagnosed with. So initially you're afraid, you're angry, you're upset, you're depressed, for yourself and for your caregivers. So I think undergoing some psychological actually treatment where you can sit and just express your feelings and know how to manage these feelings is extremely important. And on the other hand, caregivers. Caregivers are perhaps sometimes afraid for the safety of the individual. They're afraid of how will I be able to take care of my loved one and see this person perhaps become less independent. So they need the support, the emotional support, the psychological support on how to manage these types of conditions.
Exactly. And also don't ignore the signs and symptoms. As we said, it's usually mistaken for getting old or stages of dementia or other types of dementia. So if you have any problem forgetting where you put your keys sometimes, where you put your pen, whatever, when you put your stuff, this is normal. But continuous or frequent memory loss, as we said, this is a sign. So just don't hesitate to go and get checked up. If you have a family history, go get checked up. If you have a patient or any family member with trisomy 21, let them be checked up starting the age of 50. As we said, they have it even earlier.
Absolutely.
The good thing about early diagnosis, as we mentioned before, that there are medication targeted at the early stages that prevent the progression and the relapses of the disease itself.
Yes, absolutely. And when it comes to also how to live with this condition, try to make your surroundings safe for these patients, because they're prone to falling, they're prone to harming themselves, because sometimes they forget how to use a knife. So having a safe environment for these loved ones from early on is obviously vital and key.
Definitely. And I have a really good point of a person taking care of Alzheimer's disease patient, whether a father, a mother, or any family member, or a loved one, a spouse one, putting notes on where you place everything makes it easier to remember. Like in cases of the keys,
notes.
Exactly, sticky notes. You just write it. The key is on top shelf. The remote control is on the table, counter table. Like that, it will help them to remember where they placed all the stuff and how to use them. Sometimes even putting a paper where it shows how to use them with recommendation and stages with numbers. This is very important in helping people to cope with Alzheimer's disease and not to forget things and to be reliant on themselves rather than others.
Absolutely. And a way to avoid a patient forgetting names, for example, and loved ones, constantly show them pictures. Remind them, this is, you know, your daughter, this is your son, this is your wife, because this is the biofeedback stimulation. Biofeedback means seeing something, then your brain connects with this picture or this image or a mirror. So this is where your brain stimulates with your vision, so it stimulates your memory as well.
Definitely. So also I have seen this in one of the social medias for a daughter who have a mother with Alzheimer's disease, and she was videoing her daily life with her mother, and she was telling that how she's living with a person with Alzheimer's is, how does it feel? And I felt really sorry for her, because most of the time her mother will not know who she is. And that's why support is very important, whether with a psychiatrist or a loved one.
Absolutely.
But the good thing that she did is have a book with all the pictures and the names, and every time she will sit with her and show her
them,
the pictures with the names, so the mother will remember. Alzheimer, as you said, it's not something that affect the person only, but affect the family members and loved ones. And I think it's not an easy thing, but after what we have discussed, the new advances in management, how to diagnose, how to prevent it, maybe it will be easier. And we mentioned at the beginning regarding that actress when she had the role of having Alzheimer and how she was devastated. I think after what we have mentioned so far in this episode, it will make it a little bit easier and give a little bit hope on how the life will be when diagnosed, God forbid, with Alzheimer's.
Absolutely. And sometimes Alzheimer's patients, they have these momentarily parts where they wake up, let's say, or the switch flips. Now, there isn't any definite reason why this happens. They go in and out of it, but seek these moments to at least express your love for these patients.
Exactly. Unfortunately, Mariam, we came to the end of our episode. I hope we covered all the tips and points, and we wish you and your loved ones a happy life, and hope to see you again in a new episode in our program In Sync. You have a good day.
See you next time.